Good morning, Dr. Cagle.
Good morning, Gail. How are you?
I am so good, and I'm thrilled to be getting a chance to talk with you this morning. We've known each other for a number of years, but so much has happened in your career, and to get a chance to sit down with you and talk about that is really exciting. So I hope you're doing well.
I'm doing very well. It's been a wild last 18 months, hasn't it?
Yes, it certainly has. And boy, I have really thought about you. So you are getting ready to be named the CEO of Cone Healthcare System. And I'll let you tell me exactly how to say that. And wow, how exciting for you. Tell me more about your position and how you came to be there.
That's Cone Health is how we're branded.
Okay.
And I've been at Cone Health for about 10 and a half years. I came in January of 2011, and I came as the Chief Quality Officer and have had a variety of roles, Chief Quality Officer, Chief Medical Officer, Chief Clinical Officer. I'm currently the Chief Operating Officer, and in less than 2 weeks will assume the role of the CEO of Cone Health. So I've just had progressively larger roles here, and Cone Health is in Central North Carolina, Gail, and it's we have 6 hospitals and 150 medical practices and ambulatory practices, 3 freestanding medical centers, 6 urgent cares, an ACO, a Medicare Advantage health plan. So we're a large integrated health system with almost any service you could imagine. And so it's been exciting and fun for me to get to know all these different aspects of healthcare here.
Interesting. And how long have you been with Cone?
Just over 10 years.
Just over 10 years. You may have said that. So your journey has been well, I saw that you must have known early on you wanted to be a doctor. You were at 3 years old talking to your physician about being a doctor. Is that what I actually read?
Yeah. So when I was a little girl, I come from a family of teachers and ministers.
Uh-huh.
And so I, as a little girl, heard a female physician who actually had clinics in India speak at my church about that, and I was fascinated by her. So soon thereafter, I had an annual exam with my family physician in this small town in Alabama, and I told him, his name was Dr. Carrie Gwynn, that I wanted to be a doctor, that I was going to be a doctor when I grew up. And that would have been back in 1962, and Dr. Gwynn picked me up and said, "Okay, Mary Jo, let's talk about what that means." And he said, you're going to have to learn your numbers and your letters and learn how to read. And so I remember telling my mother I needed to go to the library and get a book. And my mom, bless her heart, she got me a library card right then. And all my life, she kept me with a library card. I go into the library with my mom. It's one of my favorite memories as a child.
Oh, that's such a great story.
Yeah, and Dr. Gwynn was a fixture in my life in that small town. It was the kind of small town that if you made the honor roll, your name was in the paper.
Uh-huh.
And he would cut that out of the paper and send it to me and
Oh.
say, "You are doing the right things, Mary Jo. You're going to make it." And all through my life, like when I was valedictorian in high school, he cut that out of the paper and said, "Yes, this is what you have to do." When I made the dean's list at the University of Alabama, he would cut it out and send it to me and say, "Yes, you're on the right track." So he stayed in contact with me. Even he called my office when I was in practice once to talk to me, and he wanted to learn about my practice. He would have been 82 at the time he called my practice. So a very big influence in my life. He really taught me the importance that one person can have in encouraging someone to achieve their dreams. So I try to pay that forward.
I bet you do. And that was actually one of my questions, is what inspired you to be in this line of work. But you just really shared that, from the woman who spoke in your church all the way through to someone who was an ongoing encourager, is really what I heard. So definitely modeling for you to pay that forward. And I'm sure that you do.
Absolutely. It's, in fact, I've also found not only is it important and you can do that, and it's important to do that, but it's actually, it fills my cup to do that. So I have people that I encourage, that I speak to, but that I also mentor and try to let them know what I see in them, what the possibility that I see for them.
That is a huge gift to give someone, isn't it? Letting someone know what you see in them.
Yeah, I think it's really important to tell people, yes, you can do this.
Mhm.
Sometimes it is telling people that, yes, they can fulfill their dream,
Mhm.
and then continuing to encourage them along the way. Other times it is telling people that you see things in them that they haven't seen themselves yet,
Mhm.
and letting them know that it is possible for them to do more than they had imagined. And
Mhm.
I think both of those are important and powerful gifts that you can give people.
Well, I feel like I have so many questions running through my head right now, so I'm going to try to focus myself for just a moment. And I do want to ask you, before I forget, where you were born. I'm hearing Alabama, and the birth order.
So I was born in a small town, Jasper, Alabama, which is in northwest Alabama, northwest of Birmingham.
Okay.
And I'm the oldest child and the oldest grandchild.
Okay. Okay. Oh, that's a special role right there. Well, I had to ask that and get that covered. I ask every guest that. And then we talked a little bit about your current role. And I want to know right now, the last year and a half has been just unlike anything we've ever seen, of course. So tell me about your last year. Tell me about what's gone well, what's been gratifying. Tell me about the year and what's been overwhelming.
Well, so to lead a health system through a pandemic has been honestly one of the most gratifying things I've ever done, because of how the people in the health system have responded. I have watched our team, who have such a passion for caring for this community, step up and just do amazing things and have been so selfless. We were able to open a COVID-only hospital within 30 days. And our teams came together, and really it became a state-of-the-art hospital. I mean, we've been recognized nationally and internationally for the work that they did. This team opened and got testing sites in all the counties that we serve very quickly. And then when our state asked us later for vaccinations, for us to oversee vaccination sites, we were able to coordinate with our counties and got mass vaccination sites up, coordinating with our Coliseum here in Greensboro, and just have done really a magnificent work. So to see this team be so innovative and to do things in such an agile fashion to care for this community was just amazing to see. And really, my role in it was to pull a team together and to have them meeting regularly. I guess another exciting and important part of this is we have an analytics team. And to pull the analytics team in, who were able to get the data and to begin working with the clinical team to forecast volumes and what we would expect to see so that our hospital could be prepared for staffing. And then they began to work with our supply chain to tell us, as you know, early on, supplies were hard to get to hospitals. They began to help us predict where we were when we were going to run out of supplies so that we could prepare ahead. We would know how many days. So really great forecasting that was done by our analytics team partnering with our clinical and non-clinical teams. Just tremendous work. And then I guess the other really inspiring thing is when we opened our COVID-only hospital, it was an all-volunteer team that went into the COVID hospital. So the physicians, nurses, respiratory therapists, pharmacists, even dietary services and EBS, everyone who initially worked in that hospital was voluntary. And so it was just so inspiring to see that work. And in response to that, our community responded. And we had people in manufacturing start making masks. We had our restaurant folks start bringing meals to our team.
I love it. I
So
love it.
we had coffee shop folks come and set up trucks and deliver coffee at the beginning and the end of shifts. There's this outpouring of support from our community, and the community supporting our staff and our staff taking care of the community. And I don't know that I've ever seen anything like it. And it inspired our team to continue that hard work. It was physically hard work. It was emotionally hard work. And there was also all kinds of innovation going on.
Talk about that.
Yeah. So the hospital that we created, we had just built a new women's and children's tower and moved into it at the beginning of February. The building where that women's hospital had been was empty, the older women's hospital. And then this hit. And we were able then to fully change it into our COVID hospital. It had the old neonatal ICU. And it was designed to be all negative pressure, which is exactly what you need to treat COVID patients. So we were to turn that old neonatal ICU into an open ICU for COVID. And that way the doctors and nurses could put on their garb just once and go and treat the patients and not have to go into separate rooms, because they could put all the patients there. And they wouldn't have to leave the patients alone in a room all day long just waiting for the nurse to come in. They could be present with the patients all the time. Because
of that particular type of setup, which just happened to be there.
Just happened to be there.
Yeah.
And so it was done beautifully. Then we couldn't have visitors. That was one of the hard things, right? And you heard that all over the country. You had to restrict visitors. So our IT team, working with our nursing team, said, well, we can work with that. Let's get iPads and have iPads where the patient and the nursing can talk with the families outside. So they set that up immediately, and we did iPad visiting with patients and family. And that happened almost overnight with our IT team.
Yeah.
The other thing that happened is when schools went virtually, our IT team worked with our HR team and said, we upgrade our laptops all the time. So we've got older laptops in storage. Well, let's make sure that everyone on our staff has laptops for their kids.
Oh, wow.
So we had families who didn't have that, and they didn't know what they were going to do about education for their kids. And we were able to get older laptops for made sure that all of our staff had laptops for their kids. So nobody's kids weren't able to be educated. So there was that kind of thinking going on. We went from initially doctors' offices were closed. And so we went to virtual visits. We've been doing 5% virtual visits. We went to 70 to 80% virtual visits within a matter of 2 weeks.
Would you have ever thought that the virtual visits would have been as effective? as they might have been.
No, and patients really liked them. We found out that this was really, really effective. And our docs found out that that could really work very well. And we found out not only did they work for doctor's visits, they worked for physical and occupational therapy, for rehab. I mean, the list of things we were able to do them for just grew and grew and grew. So that type of innovation of understanding everything that could be done virtually, so that things didn't have to grind to a standstill during those worst days before we had vaccinations, right? And when we wanted everyone to stay at home. So that worked. And then as our physicians learned more and more about the disease, we began to understand that there were certain treatments that we could give that could get patients, could keep people from being hospitalized. Yes. And our physicians were part of research trials, and they said, you know, we can give antibody treatment.
Yeah.
And there's a certain group of patients that can have this and not have to be hospitalized. And we started up an outpatient antibody treatment in what used to be the outpatient clinics at the Women's and Children's Hospital. So these all were things that arose from the front line, and they arose pretty quickly. They were being, I would say, iterated very quickly. People would say, here's what the research shows, let's do this. Yes. Then the realization came that once people were discharged from the hospital, they were going to need certain post-COVID respiratory clinics. Our physician offices put that together, and we developed those, and one in each of our counties very quickly, and had teams step up. So the rate of development of these services was much faster, with greater agility than anything we've developed previously. And it all developed around this platform of need of service to our community.
I'm definitely hearing that.
So, you know, I think the lesson to be learned from that is, one, when people have a passion for service, they'll develop products to fit the need. Secondly, let the people who do the work come up with the ideas to serve the people.
Yes.
And empower them to do that work.
Yes. Beautifully said.
And thirdly, not everything that we came up with was a great success. Some things we started and we said, that's not great. That's how innovation is. We're going to have to tweak that, or maybe that sounded good, but in reality, that didn't work as well as we thought it would.
Right.
We're going to have to iterate that, or maybe combine it, or maybe that's not going to happen. And you have to be okay with that, right?
Yeah.
And we were okay with failing fast.
Yes.
And moving on to what worked.
I love the language you're using. I mean, it's almost a design thinking. It's it is definitely the language of innovators, and so I know that I don't think that's usually taught in medical school. So tell me how you came to be at this place where you could lead a huge group of people doing these things so quickly and responsively.
So, Gail, we actually have some people who've gone to the Stanford D School and taken some of their short courses. And we actually have an innovation department that we bring into these projects to coach us. But not everybody has the training. So we have some folks who can coach us along the way. I would say the other piece in this is we use Lean as our business system, and we do have wide training in Lean, so that this idea of respect for the people who are doing the work and the whole idea of continuous improvement is really part of our culture and what we do every day.
Yes.
So I think those are real keys for us. And we do have a lean team, a representatives for lean who can help us with process design whenever we're on a project. But leaders across the organization are well trained in lean process.
Yes. That certainly makes a lot of sense. The combination of the lean principles and then bringing in kind of the D school thinking, the iteration, and so forth. And that's really, really powerful. I'm hearing that.
Yeah.
And so do you feel like, has there been a moment to step back yet, take a breath and just kind of celebrate the amazing things that have happened in your organization?
Yeah, so we have had some moments of celebration. Right at a year, so back in March, at a year after we opened the hospital, we made a decision to close it. The number of cases were small enough that we felt that we could take care of the cases in our other hospitals.
Mm-hmm.
And so at that time, we had a celebration, and our local media celebrated it. They did lovely, the paper and the other media did really lovely pieces on the hospital and the health system and what had been accomplished. So there was a public celebration by the community, and we did an internal celebration. We did what we called Cone Health COVID Heroes, and we let colleagues nominate people.
Mm-hmm.
And so there were particular people that we called out and celebrated, and then we took a week of celebration where we just acknowledged the team.
Wonderful. That is just absolutely incredible. I'm sure you're still unpacking all of that in terms, I see that as a paper or conference presentation, and I'm sure it will, how does it inform your organization moving forward, some of the learnings?
Yeah. So one of the things we've been talking about is capturing those learnings and that spirit of innovation, and I will say agility
Yes.
to move forward, and making that our norm and not going back to the old way of doing business. So what are the ingredients that are necessary to make that the way of doing business?
Mm-hmm.
So we've been talking a lot about that. So one thing we know for certain, there has to be a platform,
Mm-hmm.
right? We certainly had a burning platform, a reason, a raison d'etre, if you will. We had a reason to do this. We had a platform to change the way of doing business. So we recognize we have to say there is a platform for behaving in a way that we behave that changed the whole focus.
Yeah.
Second, there is focus, right? I think sometimes in healthcare, we're guilty of trying to do everything and to try to do it all at once. And when you do that, it is difficult for people to do their best work every day when they're trying to accomplish dozens of things at once.
Yes.
And I think what was so effective is we were singularly focused on making certain that we were taking care of the community, providing safe care in a time of COVID, and providing good COVID care. Mm-hmm. So how do we obtain that kind of focus is going to be important. And then thirdly, I would say in making certain that that frontline group still feels the kind of empowerment they felt during that time to express their ideas and go forward with their ideas at the pace that they felt did.
So moving forward. And you just said in your career that this past 18 months, as challenging as it was, as uncertain as it was the most gratifying because of the amazing way that people in your organization responded and stepped up to the plate. I know that you, early in your career, you delivered babies. Everyone loved you because you brought life into the world. So for you to say this is, I mean, you've had a fabulous, amazing career, and so I'm really hearing something incredible when you say that, because I know a lot of the things you've done over the years and how gratifying they must have been.
Yeah. So I have been extraordinarily blessed in my career. And, you're right. The first part of my career, I loved the opportunity to have relationships with women throughout their building their families and being part of that. That is certainly very, very special. But this was an extraordinary time in history.
Yes.
It was an extraordinary time in history, and to be able to lead a team and watch them meet, such a challenge. I mean, it's a huge challenge that, frankly, we didn't have any idea how we were going to meet, Gail. I mean, every day it just, the challenges mounted.
Yes.
And this team just exceeded all expectations and rose up and met them, and were magnificent in meeting these challenges. And through sorrow of, in the early days, when truthfully, as a medical community, we really didn't understand this disease. We didn't really know the best way to treat this disease.
Right.
So the early days, when more people were dying than we were accustomed to seeing die from a disease. So how they stepped up and comforted each other.
Yes.
And tried to keep,
yes.
There was grief. There was huge grief. And how they kept going in the midst of that, but also kept getting better and calling people. I mean, the physicians every day were on the phone with colleagues around the state, around the country. They were calling the physicians in New York who had seen it first.
Yes.
Calling physicians in California, calling physicians in London.
Wow.
They were on the phone working to get better. And then our engineers working to make the buildings better. And we had people working to build ventilators to make certain we didn't run out of ventilators. I'm telling you, the level of teamwork that was going on to support this community, and then to watch the community rise up. It was the most inspiring thing I have ever seen. And then when our analytics team said, wait a minute, we can help, and the information they started doing, they started communicating around the world to get data.
Right.
So it was our team plus a worldwide community of people working. It just was an incredible, and then our nurses who were just absolutely tireless at the bedside, bringing comfort and care
to the patient,
to patients and their families.
Yeah. You said something that was really interesting about comforting each other. And, I was talking with a young medical student, and she was talking about some of the difficulties right now being in medical school, and how they're getting a lot of teaching about, the patient care. She said, sometimes I wish we got more information about caring for each other, because they had a student to, they lost a student out of the program because it is so intense. And she said, we wish we had done more, to comfort her. So I love that that's part of your culture. I'm hearing kind of an amazing culture situation going on where you are. And I think every organization wants that kind of culture where people are just really supporting each other as well as the mission. So I'm definitely hearing that.
So I think that's one of my favorite things about Cone Health is that we have intentionally looked at our culture and designed the culture that gives us the results that we want. We pay attention. We started this started 11 years ago. What kind of culture do we need to get the results that we want? Mm-hmm. And so every place has a culture, and it either has the culture you design it to have and intentionally design, or you get something else, right? Yeah. And so Cone's been very, very intentional. And so our values, I love that you said caring for each other, because our values are we care for our patients, we care for each other, and we care for our community.
I love that. So it's really simple.
It's really simple, and better than 90% of our employees can say that without looking at their badge.
Yes, yes, they can.
And they can talk about what that means.
Yes.
And so we're really very, very intentional. And we have what we call I care principles that talk about what that means. Mm-hmm. And so we're real serious about that.
Yeah.
And so, yes, caring for each other was a really beautiful part of this. Mm-hmm. And so this was an incredibly hard time, and it was an incredibly beautiful time to watch people.
I'm definitely hearing that. And you are, this podcast will likely be released. It will be at least a month, 3 to 4 weeks down the road. And you're stepping now into a different position, and your heart must be full of, how moving forward. I guess I'm just thinking moving forward. First of all, I'd be curious to know how you feel about the pandemic now, where you feel like things are. But as you lead moving forward, I'm just curious to know kind of what your narrative will be to your people, and what you're thinking about as you enter that new role. I'm sorry, I think there were several questions at once, but I'm sorry.
Well, so my heart is full because I'm so proud of this team.
Yes, you should be.
I'm so proud of this team.
Yeah.
This extraordinary group of people. And where I am moving forward, what my hopes and wishes are for this team. This team is extraordinarily socially conscious and cares about this community deeply. Mm-hmm. And so our vision really is, we talk about wanting to transform healthcare here. Mm-hmm. I mean, that's our conversation, is that we want to really go to value-based healthcare here. We want to talk about the kind of healthcare where people get access to care when they need it easily.
Yeah.
That regardless of what your zip code is, mm-hmm. that you're getting the healthcare you need.
Mm-hmm. Sure.
And that you can count on getting a good outcome. Mm-hmm. And that your mortality doesn't get defined by your zip code.
Interesting. Yes.
And we're not there yet, but that's where we'd like to go. We talk a lot about health and wellness and how can we move toward that. Mm-hmm. We would like for more and more of our care to move toward the outpatient world instead of the inpatient world. There will always be a place for hospitals, but we'd like for people, if we do our job really, really well, you'll need our hospitals less and less.
Absolutely.
And that'd be okay with us.
Yeah.
And so how do we start working with our community partners to make that happen? we already have some things going on where we do virtual visits in some of our schools.
Mm-hmm.
So we've partnered with our school system, and we're doing that in some of our schools with the highest absenteeism.
Oh, what a great idea.
See if we can lower absenteeism. So those are the kinds of things we're interested in.
More innovation is what I hear.
More innovation
Yeah.
in service of a healthier community.
Yes.
And, you know, we want the care you get in the hospital to be of the highest quality and the safest that you can get.
Mm-hmm.
And we want you to be able to see a physician or a nurse practitioner whenever you want to, wherever you want to.
Mm-hmm.
And more than that, we'd like for you to be able to see one of our dietitians and learn about what a healthy diet is. And we want you to be able to get healthy food close to your home.
Mm-hmm. Yeah.
And
very holistic an approach, I'm hearing.
Very holistic an approach, and really in service to a healthy community.
Yeah. Mary Jo, I should probably call you Dr. Cagle, but I've just known you way too long. You're just Mary Jo to me. And I know that you're from Alabama and you never pull from Clemson. I just figured that out looking at your bio.
Well, but you know, I've worked with Clemson a long time. You know that I have had nurse practitioners from Clemson train in my office when I was in practice. So, you know.
I wanted to ask you, you were named one of the top 20 women in healthcare to watch. Tell me about that and kind of what the criteria was. That's very exciting to me and not surprising.
Well, thank you. Well, so I was really honored to be named, and they really, so I'll just say this, I'll get on my soapbox for a minute. 80% of people who work in healthcare are women, and only 13% of the C-suite in healthcare are women. So first of all, you have to be in the C-suite. Mm-hmm. And then they want to look at women who are making an impact on business, policy, and bringing up other leaders into healthcare, and then changing the face of healthcare. So those were the things they were looking at.
I see. All of which you are probably doing. Certainly you're breaking some ceilings, glass ceilings, being right where you are, because you've been in the C-suite for quite a while.
I have.
Yeah.
So, and I think the work that we're doing at Cone Health around value-based care has had effect on some healthcare policy, certainly on what Congress and CMS has been looking at for Medicare and Medicare Advantage. I feel very strongly about diversity in the C-suite, and I've been very involved in leadership development, especially among physician executives and among women and minority leadership development.
Sure. And so I want to know, as you are growing your leaders and you have a desire to get more women and others into places of leadership, what advice do you have for women who might be out there, who might be still in med school, or just getting their career started? What advice do you have for them as they go to work, maybe in hospitals and so forth?
So I would say it's really important for you to get educated about leadership, which is different than being a physician or a nurse or a pharmacist or whatever that professional thing you've been trained to do, which I had to do. Yeah. I mean, I think some of the best things that happened to me were that I got intentional in learning about leadership.
Yes.
So, which is even different than management. I would distinguish between management and leadership. And I think you've got to learn about management too. I mean, management, to me, management is hard skills, and leadership there's a science and an art to leadership.
Yes.
And so I would offer that. I would also say everybody needs a mentor, and then you need to find someone that you can watch and study
Yes.
and understand what a great leader looks like.
You actually see it.
See it.
Uh-huh.
To
And
see
you know,
it.
and here's a question here. So I see you as leader, and that looks a little different than, I feel like leadership is a little different flavor for everyone based on who they are, and you have to find all those things for yourself. Would you agree with that?
I do agree with that. And and leader and good leaders do share certain traits.
Yes, no, totally. Yeah.
Good leaders do share some certain traits. I would say, because just like we all have different personalities,
Yes.
there's not just one personality type in good leaders. Good leaders come in all personality types.
Well said.
And
Well,
introverts can be good leaders, extroverts can be good leaders. Uh, all personality types can be good leaders, but good leaders do share certain traits. And I think learning to see that is worthwhile.
yes, you said that so well. And so learning, we've talked a little bit about learning. Do you feel like you have, well, obviously you have a learning community, a growth and learning community, because they have to. You just talked all about that. They were thrown into a situation where everyone had to up their learning like ASAP, right?
Yeah, and I would say that Coon Health is a learning organization. So there is there is really attention placed on leadership learning.
Yeah.
There's opportunity for people to continue learning here.
Mhm.
So I think that's really vital.
Mhm.
And one of the things that makes it an attractive place to work. But also, regardless of whether you're a nurse or a pharmacist or whatever your job description here is,
Mhm.
there is intentionality placed on continuing to learn in your field,
Yes.
or learn about lean, or learn about design thinking. There are opportunities to continue to learn about areas that affect us all.
Now, how do you do self-care? How do you step away, decompress, and take care of yourself as a care? Because I know that's one of the most challenging things in your field.
So, my executive team and we are pretty good about talking to each other about like who's got the phones tonight, who's got the phones this weekend.
Yeah.
And so my chief operating officer and my chief clinical officer, as I step into this role, we have really intentional conversations where we say, okay, you've got it, and under what circumstances are you going to reach out to me?
Mm-hmm.
And otherwise, you're going to let me have this weekend to recoup.
Yes.
So for me, it's about having intentional conversations that say, here are my boundaries. And we all know that I'm the CEO, and under certain circumstances, you might have to get in touch with me. But otherwise, I trust you to handle it.
Right.
And so that gives me nights and weekends unless something happens. And those big things don't happen every night. So that gives me that. And then when I take a vacation,
Yes.
we have the same rules, but there are certain vacations like I'm not available.
Good for you. Good for you. And so what renews you? Are you in your garden? Are you reading? Are you
I'm a big reader. My dogs, the beach, the book. Dogs, beach, book.
Good. Good. I'm glad to hear that. And as a learner, what are you curious about now? What are you reading about, looking at?
There's a book, Adam Grant wrote Think Again. Do you know
Yeah,
that book?
I do.
So I'm really curious about how do you think again? How do you unlearn something and
Hmm.
think again? So all of the neurosciences have always interested me, and all, especially now that learning is exploding. So understanding neurosciences and how that affects me, how I act, how it might affect my team. And so that whole area is fascinating to me.
Me
Uh,
too.
that just fascinates me. So very, very interested in that. Um, so
Caroline Leaf, have you discovered her? Isn't she great?
yeah, she's fantastic. So very, very interested in that.
Neuroscience. Good deal.
Yeah. I, so yes, that fascinates me. There are a lot of things. I'm terminally curious, so there are a lot of things that fascinate me. So
That doesn't surprise me. Yes, I can see that. So it's a matter of just the moderation of being able to jump into all those things.
yeah, so so quantum physics fascinates me.
Yay.
I love quantum physics. I don't pretend to understand it, but it always, I dabble in reading it because it always is like, wow, that means I could do something here and it could affect you over there. And that's wild. That blows my mind.
Yes, yes, yes. Well, what question should I have asked you but didn't?
I think when I talk to young women, Gail, they're always asking about how do you manage the wife, mother, children, job thing. I don't know. Do you still get asked those questions? I get asked that question all the
Yes. Mhm.
so my children are now 31 and 30. And can you believe that? You
I
knew when
cannot believe
they were little. Uh, so my answer to that is we manage what we decide to manage.
it. Mhm.
And it wasn't easy, but I decided I wanted to do it. And so I did. I got help. I
Yeah.
got help. I got my mom to help me.
Mhm.
Um, and of course, I had the kind of job where I could afford to get help.
Yeah.
So that made it doable. I also didn't have a beach house and house. I had a house, not in a, I had a modest house,
Mhm.
cut back on some things to
Mhm.
be able to. So I prioritized what was important to me, which
You're
is I wanted to have the career and the kids. So I did more modest material things
right.
so that I could stay in the career and have the family at the same time. So I do believe we do what we decide we want to do.
Yes. That which is calling us, I think, sometimes
Yeah.
too,
Yes.
because you do feel kind of pulled towards something, and it's almost hard to deny. I'm curious to know if either of your children are in healthcare.
No, they are not.
No, they are not. I'm
No,
just kidding.
they are not. No, they are not. My
Yeah.
youngest one thought about it for a little while and then asked about it and then asked if he could do it and not work as much as I did.
That's a valid question.
That's a valid question. And I said, I don't I don't know how you could do it and not work as much as I did, but
Well, that's so interesting to hear a career. Early in my career, I worked for Blue Cross Blue Shield, and it was 75% women, and I feel like it was one of the best places to start a career because I had so many women that taught me so much.
yes.
So I still, just phrasing and the way they worked with each other and worked with physicians, and I just learned a ton, and I'm so grateful for that that opportunity to be, to have started there. So
Yeah.
grateful for my journey, but I'm grateful to have met you early on, and I certainly learned a lot from you, and have been watching your career, and I love the place from which you're leading right now. And I'll be sharing this podcast in my innovation and creativity classroom this summer in the MBA for entrepreneurship and entrepreneurship, because I talk a lot about entrepreneurship. There's a lot of creation that can go just like you guys are doing.
Yeah. Okay.
And so I love the illustrations that you presented us here today, and I can't wait to see what you're going to do as CEO. So I'm going to look forward to sharing your voice in my classroom, and hopefully maybe getting you to speak at a graduation sometime, if that's something you might be open to.
Thank you, Gail. Be glad to.
You have,
Thank you.
You have so many fans here in Greenville. People you delivered, and all kinds you have a lot of fan base here, so getting you back here would be really, really cool. So
thank you, Gail. Well, thank you for helping me get started in the right direction. I laugh when you say you learned from me. I learned so much from you. Thank you for helping me get started off on the right foot.
Thank you. All I did was listen, but I appreciate you saying that.
Listening is one of the most valuable gifts anybody can give another.
Yes, I think it's a gift as well. I certainly do.
Thank you, Gail.
Thank you, Mary Jo.
All right. Bye-bye.